Hello everyone. Today our new topic is edema. Definition of edema. Edema is an abnormal accumulation of fluid in the interstitial spaces of tissues and cavities of the body. Here what happens, there will be the abnormal accumulation of the fluid. It will be caused by the imbalance between the forces that regulate the fluid movement across the capillary walls. It further leads to increase in the hydrostatic pressure or decrease in the oncotic pressure. Here what happens, there will be the sudden rise of hydrostatic pressure that ultimately leads to decrease in the oncotic pressure. This edema may be occur to any part of the body, but most commonly observed in the dependent areas such as the legs and the feet. Etiology of edema. What are the main causes that involves in the edema? It is mainly characterized by the accumulation of fluid in the interstitial spaces of tissues that results in swelling. Here, the main causes involved in four categories like increased capillary hydrostatic pressure, decreased plasma oncotic pressure, increased capillary permeability, and obstruction of the lymphatic flow. In case of increased capillary hydrostatic pressures, what happens in some of the cases like the patients affected with the congestive heart failure, renal failure, or cirrhosis of liver, continuous, there will be the rise of hydrostatic pressure. Decreased plasma oncotic pressure. In case of hypoalbuminemia and nephrotic syndrome, there is a sudden loss of protein level. So, as there is a decreased protein intake, the patient and the people who are suffering with the nephrotic syndrome and all, there will be the decreased plasma oncotic pressure. And in case of any further infections or inflammations and allergic reactions, there will be the increased capillary permeability. It leads to edema. And in case of lymphedema, there will be the obstruction of the lymphatic flow. What are the risk factors that involved in edema? If the patients are suffering with heart failure or kidney disease or liver diseases, we can mostly observe this edema. Here, in case of heart failure, what happens? The heart is unable to pump the blood effectively. So, thus ultimately lead to fluid accumulation. In case of kidney disease, what happens? There will be the imbalance in the fluid and electrolyte levels. If the patient is suffering with the liver diseases, there will be the fluid buildup in the abdomen and the lungs. In case of malnutrition, if the patient diet is lack of protein, that ultimately leads to low blood protein levels. Thus, what happens if the blood protein levels are reduced? It causes the fluid leak into the tissues. In case of pregnancy, due to some hormonal changes, there will be the increased pressure on blood vessels. So, mostly in pregnant women, we will observe the pitting edema or peripheral edema over the leg area. Pathophysiology of edema. It is explained by the Starling's law. Here, the balance of hydrostatic and osmotic pressures will be monitored. The hydrostatic pressure within the capillaries, what this hydrostatic pressure will do within the capillaries, it forces the fluid out of the capillaries, while the osmotic pressure within the capillaries tend to pull fluid back into the capillaries. If the hydrostatic pressure exceeds the osmotic pressure, what happens? The fluid will be accumulated in the interstitial spaces. If the mechanism had gone vice versa, it ultimately leads to the edema. The factors which contributes to this edema is increased capillary pressure, decreased plasma oncotic pressure, increased capillary permeability, and impaired lymphatic drainage, as though we had seen in the etiology. So, for example, pulmonary edema occurs when there is accumulation of fluid in the lungs, while peripheral edema occurs in the legs and the ankles. Thus, it depends on the underlying causes wherever it will be affected. Clinical manifestations of edema. Here, the edema will be characterized based on the location, severity, and underlying cause of the condition. In case of pitting edema, what happens? It is characterized by the presence of indentation or pit that remains after the pressure is applied to the affected area. Mainly, the pitting edema will be observed in the lower extremities. In case of heart failure, liver cirrhosis, and renal disease, we can observe this pitting edema. Second one, non-pitting edema. It does not leave any indentation after the pressure is applied. And it is mainly seen in the conditions such as lymphedema, mixed edema, and lipedema. Localized edema. In this edema, we can observe the edematous area in the specific part of the body, and it is often caused by the trauma, infection, and the inflammation. Then the last one, generalized edema. It affects the entire body and often associated with the heart failure, liver cirrhosis, and the renal disease. Diagnosis and the management of edema. Here, how we can identify this? By doing the routine history and physical examination. By performing the patient's medical history, physical examination, and laboratory tests, any changes in the medications, in the history, and in the physical examination, we need to identify the presence, the location, and the severity of edema, and as well as what are the conditions that are causing the edema, we need to observe in the physical examinations. Coming to the laboratory tests, we need to perform the laboratory tests such as some blood tests, which helps us to assess the kidney and liver function in case of any nephrotic syndrome or cirrhosis of liver, and some of the imaging studies such as ultrasound or MRI, it helps us to identify any block in the circulatory system. For pharmacological management of edema, mainly diuretics and acetylcholine. Pharmacological management of edema. It involves the use of diuretics and angiotensin-converting enzyme inhibitors. For example, if the diuretics involves, it increases the urine and reduces the swelling by stimulating kidneys to remove the excess water and sodium. Diuretics include hydrochlorothiazide, loop diuretics such as furosemide, diuretic that saves the potassium such as the spironolactone. Whereas the angiotensin converting enzyme inhibitors include, it regulates the BP and fluid imbalance. Angiotensin converting enzyme inhibitors and the gestrin. This induces the hypotension, hyperkalemia, and renal dysfunction. Exercises also may be used in case of the patients such as the persons affected with the renal impairment and the electrolyte imbalances. Some conditions, BP and the renal function monitoring also advised. Non-pharmacological management of edema. It mainly involves in reducing the swelling and improve the patient's overall condition. It involves compression therapy, elevation of the affected limb, dietary changes, exercises, and the massage therapy. As we had seen this compression therapy, it involves the use of compression stockings or bandages. It helps us to provide the reducing the pressure over the particular area, thus it reduces the swelling and improves the circulation. Elevation of the affected limb. If the elevation of the limb above the level of the heart, it helps to reduce the swelling and improve the circulation. In case of dietary changes, we need to encourage them to improve the intake of foods that are rich in potassium. It helps us to reduce the fluid retention and the swelling. Exercises. General and regular exercises helps to increase the circulation and reduce the swelling. Finally, massage therapy. It improves the circulation and reduces the swelling. So, it should be done by a trained professional and with the caution in patients who are having some medical conditions. The main nursing management of edema includes assessment and diagnosis, management, and nursing care. In case of nursing assessment and diagnosis, we need to identify the proper history and physical examination, and we need to identify for any swelling, pitting, and any skin changes. We need to regularly monitor per patient's weight, BP, and the urine output. Coming to the management, according to the prescription of the doctor's order, we need to maintain the pharmacological management and non-pharmacological management. Pharmacological management includes the diuretics and the ACE inhibitors. In some conditions, calcium channel blockers also may be used. Nursing care involves the proper education to the family and the patients regarding the medication usage, lifestyle modifications during the exercises, self-care techniques such as the skincare and exercise, using some skin emollients and proper massage. It helps to reduce the edema. Nurse should also monitor the patient's response to therapy, how the patient is responding to the treatment, whether it is getting reduced or further increased. We need to observe, and if any adverse effects are observed, we need to immediately inform to the healthcare professionals. In this topic, we covered all the aspects such as definition, etiology, risk factors, pathophysiology, clinical manifestations, and the management of edema. I hope you understand this session. If any further questions or anything I need to improve, please keep the comments. Thank you, one and all.